Mr. President, I rise to discuss for just a couple of minutes this afternoon the issue of health care, and in particular the legislation that was unveiled today, what is referred to as a discussion draft. So it's legislative text, but it's not the final word on this issue. So we have to begin in earnest to engage in debate because we're going to be very limited in the time that we have. I think the best way to describe this legislation can be very simple, actually, in terms of, I think, the impact on a lot of Americans. This is, unfortunately, I don't think it really an effort to improve a healthcare system. I think it's a scheme. It's a scheme that sells out the middle class. It hurts seniors and children and devastates the protections and health care for individuals with disabilities over time. And all of that is done to finance tax breaks for the very rich. There are other ways, of course, to describe it, but I'll focus mostly on Medicaid. As it relates to Medicaid, this isn't a repeal and replace or repeal and improve or repeal and reform. This is repeal and decimate when it comes to Medicaid. The cuts may be stretched out, but they are in fact deeper over time. So if you're one of the 1.1 million children in Pennsylvania that receives Medicaid, or over 720,000 Pennsylvanians with a disability that benefit from Medicaid, your health care could be at risk. My test would be if any of those individuals lose their Medicaid benefits, it's a bad bill. And I would hope that would be the test of every member of the Senate. The other adverse consequence to this legislation is it will cripple efforts to battle the opioid addiction in our country. We just had a great consensus at the end of last year, where both parties came together on two pieces of legislation. One that dealt directly with the opioid epidemic, so-called CARA bill, Comprehensive Addiction Recovery Act, and then later in the year, another bill which provided some additional funding. All of that would be compromised, undermined, or degraded at least if this legislation went through, because the biggest payer, or certainly in the top two in terms of our paying for opioid treatment and services is, of course, the Medicaid program. So what we have here before us is a bill that's a tax giveaway to the wealthiest. The top 0.1% would receive thousands and thousands, if not tens of thousands of dollars. One estimate of the earlier version of the House bill said that if you were in the top 0.1%, you got $197,000 each. Those people don't need $197,000 from in a tax break from a so-called health care bill. They would, I think, expect that we would take care of the people that need health care. Vulnerable children. 40% of the children in America get Medicaid, 40%. Almost half the births in the country are paid for by Medicaid. People with disabilities are disproportionately dependent upon Medicaid. And they should have a right to expect, and their families should have a right to expect. If you have a disability, you should get Medicaid today, tomorrow, years from now, decades from now, as long as you need it. You should have that guarantee. This bill takes away that guarantee for those families with a loved one with a disability. One of the many stories that we get from back home are from parents, and many of them writing because their child has a disability or multiple disabilities, and they're dependent upon Medicaid. Here's just one. My son Anthony was born at 25 weeks, and he weighed 1 tiny pound. We were overcome with medical bills, which Medicaid thankfully paid for us. Since his birth, he has had multiple health crises, seizures, sleep disorders, just to name a few. More recently, Anthony was diagnosed with autism spectrum disorder, Tourette syndrome, severe obsessive compulsive disorder, and dyspraxia. He has suffered the most physically and mentally because of his Tourette's. It's severe, and he's frequently unable to attend school due to his tics. They are painful and debilitating. They make him unable to eat, breathe, and see at their worst, far from what is commonly depicted on the movies and in the movies and on TV. And then this father goes on to say, 2 years ago, I was forced to quit my job of 20 years as a therapist to stay at home and care for Anthony because of the amount of doctor's appointments he has and the number of days of school he misses every year. Luckily, with medical assistance, that's the Pennsylvania version of Medicaid, with medical assistance covering his services, I am still able to do so. If we lost coverage, we would not be able to provide the support that he needs. We are sure of that. I truly realize that unless you're actually living this kind of life, it's easy to turn a blind eye. I can assure you that my story is much like thousands of others that depend, and he has that word depend in all capital letters, depend on funds from medical assistance to cover doctors, to cover medications, therapies, durable medical equipment that children with disabilities require. Families of children with disabilities are desperate to not lose those benefits. My son Anthony is currently attending school almost regularly and functioning the best he has had for a very long time, thanks to the services he received from medical assistance, unquote, otherwise known as Medicaid. So that's the reality for a lot of families. Now, I can hear some folks in the Senate saying, well, maybe Anthony won't be affected because it's the Medicaid provisions are going to be up to the states, and the states can handle that. We're just going to put a cap on the dollars, and we're going to wind down the Medicaid expansion, which covered 11 million Americans at last count, and the states will handle it. So we're sending back these challenges and the disproportionate burden that states will have to bear to make sure that Anthony, who has all those challenges in his life, has the coverage of Medicaid. And the federal government will just wash its hands of that responsibility. No, Medicaid is a guarantee now based upon your eligibility. That guarantee should remain. And we're a great country. We have the strongest economy and the strongest military in the world, and we have the Medicaid program. We don't have to sacrifice those kids or sacrifice the health care for one child who depends upon Medicaid. We don't have to sacrifice that child in order to have another part of our budget funded appropriately. That's an insult. And anyone who is going to choose to support legislation that would fund tax cuts for the wealthiest at the very same time, in the very same bill, will result in others losing coverage. And I'm not only talking about children with disabilities, I'm talking about adults who got coverage, 20 million people in the last couple of years. For any member of the United States Senate to choose tax cuts for the wealthy over those children and over those individuals, I think should examine their conscience, to use an old expression. Because this kind of a policy that results in the most vulnerable among us losing their health care coverage is obscene. And there are a lot of other words we could use, words we can't use here. Because that's the definition of an insult to our values and to our country. We're a better country than what we will become if this chamber votes in favor of a bill that will decimate Medicaid the way this bill will. I realize it might take a long time. I realize that it might be another presidency or many Congresses from now, but the deed will be done here that will lead to that kind of misery. And we have no sense of the misery that will be imposed upon those families because we've never had this before. We've had a program in place for 50 years, and it's helped a lot of kids with disabilities. It's helped a lot of families be able to hold down a job while their child gets the benefit of Medicaid because of a disability. It's helped a lot of poor children rise up from poverty and overcome terrible poverty because when they were kids, when they were very, very young, they got early periodic screening, diagnosis, and testing. The kind of early intervention in good health care that children get on Medicaid. And a lot of seniors get into nursing homes. A lot of middle-class seniors or from middle-class families get into nursing homes solely because they get the benefit of Medicaid in addition to Medicare. And the last thing I'd say is that I think senators in this chamber should think about the basic inequity. When they have health care, everyone here has health care, all right? All the families here have health care. All of our loved ones who are dependent upon us have health care. And yet some will vote to take away health care from some, and in the very same bill, vote for gross, obscene tax cuts for the wealthiest among us. Most of whom, I would bet, don't want those tax cuts. They'd rather see us take care of the vulnerable. So it's a basic choice. This isn't complicated. This is a very simple choice. And I hope that in the course of this debate, that some will come forward with some courage and some guts and some compassion and do the right thing and vote this bill down.